On this episode of the Ask Mike Reinold Show, we talk about some strategies to focus on treating athletes in your physical therapy clinic. The Ask Mike Reinold Show. Helping people feel better, move better, and perform better. Before we get to the podcast, I wanted to make sure you knew about my free online course on the introduction to performance therapy and training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to mikereinold.com/performance to sign up today. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. I am up in Boston at Champion PT and Performance, joined by, let me see, we're missing Dewesh today, but that's okay. We're just still joined by a good group of us here at Champion. I got Dave Tilley, Lisa Russell, Dan Pope, and Mike Scaduto. Wait, did I say Lenny?
I'm here.
Did
Hello.
I say you, though? Did I?
I don't know. I wasn't paying attention.
and Lenny McCreena. I don't know why.
Oh, yeah.
I just it's not ordered weird. I don't know why I skipped you, but and Lenny McCreena answering your questions. Anything you guys have for us, PT, fitness, sports performance, business, career advice, whatever you want to talk about, ask away. Head to mikereinold.com, click on that podcast link, and you can fill out the form to keep asking questions. Len, who's our extraordinary student right now? We only have one.
This is a very unusual time at Champion to have one student. So it's Trevor. It's all Trevor all the time.
Why is that? Why do we only have one?
We had nobody apply for our intern. No, I'm just kidding. We had so many people. It just happened to work out that this 1 week is a loner for some reason. And we have somebody coming next week. So
because we had 13 students at once for a couple months.
Yeah, exactly.
That's probably true. We did have a lot of students, but you know what, Trevor, though, this is giving you some time to shine, bud. You're doing a really good job. So keep it up, man.
Yeah, you get to reflect. This is the first time we've seen Trevor's face too. So this is Trevor Claridge from Belmont University down in Nashville, not Belmont, Massachusetts, where we live. He's a PT student from Belmont, and great to see your face. Great, good face.
All right, Trevor, before we get to the question, and this is a question everybody, even the listeners there too. This just happened to me in the clinic yesterday at Champion, but how many people have seen a patient for the first time with their mask off and been shocked? That just happened to me yesterday. I'm like, that's what he looks like. Why is that?
I have battled a girl 2 months ago for her knee, and she just took her mask off for water yesterday in the gym. I was like, oh man, what?
Right?
The kid yesterday is like 6 months out of a Tommy John, so it's not like he's been rehabbing with us for like months and months and months, maybe even longer.
Yeah, he's on his and he's been training with us. He's in our gym all day. I mean, he's here all the time, and I was just like, wow, interesting. But not in a disappointing way, right? But just in a
but a baby face way.
Yeah. Anyway, all right, Trevor, what do we got now that I feel like we're connecting right now since we can see you. So what do we got for a question today?
So Thomas from New Jersey, is it possible for a clinic to only treat athletes?
Oh, Mike, you're.
I'm like, was that the question on the bottom?
Yeah. You said to go in reverse order.
Okay, that makes sense. No, all right, we'll talk after. that was good. I was looking around. I'm like, that's not. All right, we'll talk. I explained that poorly. I have so many thoughts in my head that I don't articulate well with my mouth. So I apologize, Trevor. You're the man. All right. So Thomas from New Jersey. I thought this was a good question. We actually had about 2 or 3 questions that were very similar to this the last couple of months. So I thought it would be good that we can tackle this. I wonder if this is just because, there's schools are graduating now and people are sitting for the boards and stuff and they're starting to think of stuff. But I think Thomas's question was really good. He essentially just said, like, is it possible for a clinic to only treat athletes? Right. And I went back and forth in my head about like a lot of things on this, but who wants to start? Who wants to tackle this one and talk about it? Is it possible? And then I don't know, maybe is it possible? Is it wise? And how do we help people get there? Because I think that's the real reason, right? What do you got, Lisa?
I mean, I guess my first thought is like, how are you defining athlete? Because
I would say a human that plays a sport.
Right. or just like somebody who wants to be an active individual, I don't know, but like I guess in my head, my initial picture of an athlete is like a teenager to college age person, but like athletes are 60-year-olds and 70-year-olds who just like want to keep doing what they want to do.
I love
So,
that. That's a really good point, Lisa, because and this is a question for Thomas, because obviously you can specialize in anything. You can specialize in one sport, one age demographic. You can specialize in anything, right? So I like that. And Lisa, I think you made a really excellent point there. Like, and Thomas, don't think that an athlete is just like a high school, football player, right? And I think that's probably what a lot of people think. Like, realize that a lot of Gen Pop people in later phases of life want to be athletic and may have athletic like injuries and may want to get back to sports. So that, I think that's a really good starting point, Lisa. I like that. What do you think, Len?
I was just saying that I'm a 46-year-old who wants to be an athlete. So I guess
I know, right? And I mean, and I hurt every day, right? Like something is bothering me every day. It's crazy, but
I screwed up a cartwheel yesterday and I screwed up my shoulder, but I'm good. It won't affect my. I just want to hit hellacious bombs on the golf course. But no, I mean, I agree with Lisa. Like, what's an athlete? And I think that's part of our website. That's part of our core values and how we kind of founded Champion was if you have a body, you're an athlete. So, like let's anybody like when that's kind of what we do at Champion, right? Like. We get people who are 40s who do CrossFit. We get people who row in their 50s. You know what I mean? We have high school, college kids, professional athletes. That's what we do. We're all over the place with that. And so I think we've created a little niche that way that people value what we do. So I think it definitely is possible. I think we get very few people who are not trying to do something very specific because and they seek us out, whether it's after previous PT elsewhere or they just seek us out from the beginning. It's there. They have a specific goal in mind, and I can think of numerous people that all of us are treating. So it definitely is possible.
So let me ask you a question, Len, before we get to Dave, but do you think Champion classifies as that? Do we only treat athletes?
No. And it's not like we're like turning people away because they're not an athlete. It's not like that's part of our questionnaire on the phone. Like, what's your sport? Oh, sorry. We can send you elsewhere. No, I mean, that's just, I guess that's our reputation, maybe. I don't know, but we definitely see people that are not doing a sport, I guess, or some kind of hobby. But I think it's definitely in the minority of people that we see in general of our population. But I think it's very rewarding. Like I treated a guy who had a partial knee replacement. So rewarding to just get him back and get back to what he wanted to do, which is just have a pain-free knee,
Yeah, that's a good point. What do you think? What do you think? We're like 90-10 athletes though, or 80-20?
I would say yeah, something like that easily.
So I mean that's probably and was there a connection to this person? Is there a reason why you saw it? Was he?
I treated his kid. Yeah, so I treated his kid who was a high school lacrosse player, and the kid had a good experience. The parents had a good experience with me, and they're like, I want to rehab Lenny.
Yeah, and I think that is the number one reason why it's going to be hard to only treat athletes, right? Because you're always going to get situations like that. But I think you phrased that well. What's up, Dave? What are you thinking?
Yeah, I mean, I guess the first thing that popped into my mind is like, is it possible? Yes. Is it optimal? No. Like, I think for everyone involved, clinicians, clients, obviously, right? Like clients want to be able to get your services. But I think the danger from a clinical point of view is that when you start to come out and only be a specialist for sports in general, or just types of different sports you like or you work in, I think you really undermine your ability to be a great clinician from a holistic point of view. Because in my experience, and I think Dan and I have a similar experiences, like we actually started in more of the general setting and kind of went like, okay, what is like the knee joint need? What does the shoulder joint need? How do you treat just a general back, for pain? And I think that when you master the body parts in a movement system, and then you funnel that into like, okay, well, what are the top 5 injuries I see in a baseball player or, someone who does CrossFit? I think it's a much more, it sharpens your tool set to be able to clinically think that way. I think there's an error in going the other way of being like, I'm only going to treat, throwing elbow injuries, but I know nothing about general lateral epicondylitis or something of that nature. So yeah, I would say from the clinician's point of view, and then obviously from the business health, and then also the client's point of view, being really good just dealing with general, aches and pains is probably the best way to start.
And I think that's a really good point here too. And I like how you said that if you don't know how to treat like a Gen Pop orthopedic diagnosis, and you're only working with athletic diagnoses with a joint, you're going to miss stuff.
Yeah.
I think you're gonna miss a lot of things, right? And I think that's an important concept. And maybe for the younger crowd, maybe for the early career people, the students, if you're a veteran, you've been doing this for 10, 15, 20 years, and you want to start saying, I only want to do it. I think you've earned that right, though, right? I think that satisfies your concern there, Dave. So I think that would vary depending on where you are. What about the finances of it? I mean, I know, so like, the business owner hat comes on. I think there's a reason why most clinics treat Medicare patients is they reimburse some of the highest in the world, right? And if you're only treating athletes, you also think about that too. Then, especially like if it's a, high school based thing, which is pretty huge. What are you going to, your clinic's only going to be open from 3 o'clock to 10 o'clock, right? What are you going to do all morning, right? So you might as well load it up with some other people to generate revenue in the square footage that you're paying rent on every minute of the day, right? So especially if they're a higher paying insurance thing. But that being said, I mean, we certainly don't think of it that way, but I understand why people do it that way, and we don't act that way at Champion. But so I don't know. I mean, I think if you kind of put all the responses together here, is I think very few people will, even us at Champion, which we're probably the most athletic place I know. I don't think we're 100% athletes, and we're perfectly okay with that. Not only do we enjoy it, but I think it really helps us think and grow and stay current and active, right? So it's not that you can't. Now, how do you do it, right? So let's now like end with maybe that little thing. And if anybody has any thoughts, jump in. But how do you do it? And I think for me, like the biggest thing is like just keep over delivering on the patient population that you want to see the most, right? And make sure you're mastering it. You're doing as best as you can and over delivering it. And over time, it'll grow, right? And I think I wrote this as a newsletter a few months ago on one of my weekend newsletters. And then I think I liked it so much, I made it a blog post. I don't remember if I ever published it. So I'm a little behind, but I think I wrote like, how do you evolve? And it's like, when you first start practicing, it's probably, and you want to get into sports, it's like 20% sports and then 80% everything else. Cause like you're the rookie, right? You're getting, the evals that the other patients, the other therapists don't want maybe, but then you really over deliver on that crowd and it slowly starts growing. And then your other crowd shrinks, and then all of a sudden you're 80-20 treating that client population that you want the most. So how do you do it? It takes time. When you're first opening your doors as a clinic, I'd be really scared financially to just say we only treat athletes, right? Because it's, I mean, you're a physical therapist. You can help athletic people. And I think that goes back to Lisa's first comment here, was that a lot of people want to use their body just like an athlete. A lot of people want to be treated like an athlete, even if they don't play a sport. So keep that in mind too. I think you want to do that, but you got to get going, and you got to kind of like steamroll that a little bit before you put up those red velvet ropes and say that we only treat athletes. Does that make sense? So can you do it? I have no doubt you can do it, Thomas. I think you can. I don't think that's the issue. But it's something to really kind of keep in mind. But what's the fastest way to get there in my mind? Over deliver like heck on the athletes you have, and word will spread over time, and you'll get there. And like, don't get me wrong, that's like assuming like your clinic doesn't just have like parallel bars and a total gym in the corner, right? Like, no offense if I just describe your clinic, but you know what I mean? That's not a sports kind of clinic, right? So if you don't build a sports clinic, it's going to be really hard to draw athletes, right? They're not going to go there and be like, this place is for me. Right. So you come to Champion, it looks like a gym. It looks like a performance center. It looks like a training room. And we act like it's a training room, which is what like a lot of athletes feel comfortable in. So we kind of created that environment. So awesome. But good question, Thomas. Good luck with that. I'm sure you'll do well. I think it's possible. I think there's a lot of good variables in there. And, I think more and more people, the more you focus on one specific niche, whatever that is I think you can do it. So good luck with that. Great question. If you have another question like that, again, head to MikeReinold.com, click on that podcast link, ask away, and be sure to go to iTunes, Spotify, rate, review us, and make sure you subscribe so we can keep doing these episodes every week. Thanks so much. See you guys next time.